This week on Healthy Living, they can be substandard, unregistered, or falsified. The fight against counterfeit drugs continues. A new tool in Côte d'Ivoire helps track fake medicine. We'll see how. Plus, Zambian health workers trained to fill gaps in hearing care. Finally, a Nigerian author helps children stay informed about the coronavirus. That's in this edition of Healthy Living. Hello, I'm Lina Ahmoudou. Thank you for joining us on Healthy Living. You can find them in street markets, small shops, websites, and even in health centers or pharmacies. Counterfeit or fake drugs include substandard and falsified products that may contain no active ingredient, the wrong active ingredient, the wrong amount of the correct active ingredient, or other toxic chemicals, according to the World Health Organization. Fake drugs affect every region of the world and contribute to drug resistance, disability, and death. WHO says antimalarials and antibiotics are amongst the most commonly reported substandard and falsified medical products. Let's go to the Ivory Coast, where a new tool is helping in the fight against counterfeit drugs. A startup company now helps pharmacies digitally trace the sale of drugs to their customers. Yassine CEO has more in this report, narrated by Lionel Gahima.
This alley in Abidjan's Adjamé district is part of Roxy, West Africa's largest market for fake, substandard, or illegally distributed medicine. Awa Koulibaly says she's been selling pharmaceuticals here since August.
Medicines for fatigue, malaria, stomach pain, everything.
Here, shoppers look for medicine at bargain prices.
The pharmacy charges 6,000 francs for something I can get here for 4,500. When I don't have that much money, I come here. When I have enough, I buy from the pharmacy.
Wilfried Osso is among the estimated 40% of Ivorians who buy antibiotics, antimalarials, and other medicines on the street. But there's no guarantee that products sold here contain the proper ingredients or incorrect amounts. The World Health Organization says roughly 1 in 10 medical products in low and middle income countries is substandard or potentially toxic. Ivorian authorities have closed the Roxy market several times to get counterfeit medicine off the street. To safeguard customers, the nearby Nouvelle Pharmacie Fraternité last year began using technology from the startup company Meditect. It tracks medicine from the source to the point of sale. Pharmacy assistant Ange Bouri demonstrates.
I scan the package with my phone's camera, and it tells me when the medicine arrived, where it came from, and how much is in stock.
A QR code verifies authenticity of the medication and traces its journey from laboratory to pharmacy. It also lists possible drug substitutions.
The prescribed medicine may be out of stock, but this app recommends good alternatives. I don't let the customer leave without medicine because out there he can meet ladies selling street drugs.
Meditect's smartphone app is available free to Ivory Coast pharmacists and patients. Right now, Meditect only authenticates medicine from its partner, the French pharmaceutical company UPSA. Meditect aims to extend its reach in sub-Saharan Africa, says co-founder Arnaud Pourredon.
We take advantage of the internet being everywhere throughout the entire sub-region. There is a very good penetration of smartphones as well. We come up with a solution that is mobile, that is digital. That is how we have a very strong impact.
Pourredon says Meditect's software will also be able to monitor patients. This new digital solution will be introduced in January in Ivory Coast, Senegal, and Cameroon, and perhaps one day throughout French-speaking Africa.
Dr. Yubrin Mora Gachemba is an internal medicine physician at Nairobi Hospital in Kenya. She tells us more about the scope of the problem of counterfeit drugs and what can be done.
Counterfeit medicine is really like a substance that is intended for a particular purpose, but is not achieving that purpose because of either an omission or commission or an underdose, or just lack of efficacy completely because the drug is not even present. And also it's medicines that are maybe expired, so they're not able to achieve that. And the other thing I think from the African continent that we've noticed is maybe having drugs that are intended for a particular market that they're a bit more substandard. Africa is topping the list in terms of where most of the counterfeit medications are finding their way into our market. I see a lot of the times that we really get adverse patient outcomes as a result of substandard drugs in the market. So you see, for example, if a patient is a hypertensive and they're getting counterfeit medication, they'll think that they're controlling the condition. But as we know, some of these conditions, if not most of them, are really asymptomatic, meaning there are no symptoms that are being witnessed by the patient. But by the time the patients are presenting to hospital, they're already suffering adverse outcomes or adverse events, like even death. Maybe we need to educate our patients more, create more awareness so that the patients are aware of the medication they are taking, where do they source from, are they achieving the intended result. But the other angle is really to look at the regulatory bodies. We don't really have an African drug regulatory body. We always wait for another regulatory body from another part of the world to approve drugs. We don't have one for our African continent. And I think it's about time that we protected our population from counterfeit medication coming into our market by making sure before anything comes to our market, it is approved by a joint body or regional body that is in different areas of the continent. And also government having more stringent regulations and rules on what is imported into specific African countries, how are they checked, and even the regulatory bodies are water sealed in terms of making sure that we don't have corruption. The pandemic, just like most of the other communicable diseases and even non-communicable diseases, requires medication. There's been a lot of speculation about people thinking that what would work for this condition, people taking a lot of over-the-counter medication to try and have some sort of prevention from acquiring the virus. You'll be surprised that our counterfeit markets are actually in our pharmacies. Our regulatory bodies are not as empowered or as well structured and organized as the other global bodies. And the other places are like people still buying from small illegal health facilities that sometimes are not even registered, that they go and buy there. And even some traders who make medicinal claims that are not right and they don't have scientific backings. And they're even able to sell online. They're able to sell in shops that are open in the broad daylight. They are everywhere and easily accessible.
Kinshasa police carried out an operation to apprehend the sellers, manufacturers, and consumers of a new drug, which is very popular among young people. Called Bombay, this drug is made with dust extracted from car parts. Dilidico has the story.
The head of the Kinshasa Police Anti-Crime Unit explained that special operations have been carried out to track down drug traffickers. He calls attention to the excessive use of drugs such as heroin, cocaine, and Bombay. Bombay is made using the exhaust residue from catalytic converters, the car part that cuts the emission of the toxic gases in exhaust pipes.
They are substances made to be used in engine, in cars. So we have food, we have things to take for our body. We do not have to take substances from cars, made for cars.
People also add other ingredients like sedatives or smoke it with tobacco. Some experts say the drug can cause people to sleep for days, and the metals in the catalytic converter can be harmful to your health.
Since no one knows exactly how this drug, makes consequences in people's body, the fear is that we will be discovering maybe in the forthcoming weeks and months, but unfortunately we don't know. But we're afraid of cancer, high blood pressure.
The United Nations reports a 30% increase in drug abuse from 2009 to 2020. And the global recession, which affects low-income countries more than developed countries, makes people there more susceptible to use and sell drugs as a way to cope.
Global data shows that 1 in 5 people worldwide live with hearing loss. In Zambia, 5 ear, nose, and throat specialists and 1 audiologist are serving a population of 17 million. Zambia is addressing this gap through a special pilot program to train health workers on primary ear and hearing care.
Alice suspected the problem when her 3-year-old will cry when anyone so much as touched her ears. They live in a rural community in Zambia, and unfortunately, there weren't many options for care.
I wanted to go find medicine. That's when I was told that there's a nurse in Pula who is working on ears. Without hesitation, I went to the clinic. That's how she checked her up, found her with ear problems, and gave her medicine.
But there's good news. Over the last year and a half, about 200 nurses, healthcare workers, and clinical officers have been training based on ear and hearing manuals from the World Health Organization. So Alice was able to get help for her toddler. Nurse Carol Sikende was able to see Alice's daughter, Memory. She has seen more than 600 patients so far. Before this training program was implemented, people would travel to the nearest city.
So the child had a perforation in the left ear, but ever since I've started seeing this child, I've noticed that the perforation has gone down due to the medication that we are giving, which is an indication that the child is actually getting better and getting well.
The program has been provided under the government's National ENT Strategic Plan in response to a World Health Assembly resolution on preventing deafness and hearing loss. 1 in 5 people suffer from hearing loss globally, and about 80% of them are in countries lacking adequate health care services for hearing, according to the WHO.
As the coronavirus has spread in Nigeria, Africa's most populated country, so have myths about the virus, especially among children. A Nigerian author has written a children's book to help them understand the pandemic and ways to avoid being affected. Timothy Obiezu reports from Abuja, Nigeria.
A team of educators arrives at a government school in Abuja. They are here to educate school children about the coronavirus pandemic and personal hygiene. They're equipped with books, face masks, and sanitizers. Daniel says the initiative started last year when COVID-19 hit Nigeria.
But because COVID was evolving, I knew that I wouldn't have one edition of the book. So we've had different editions of the book. I had to update it from time to time. The support that we have received has mostly come from social media and from funders who have seen our work.
The COVID-19 children's book is titled "There's a New Virus in Town." It has colorful images along with text to help children understand the deadly virus better.
I wash my hands regularly, wear my face mask, keep your compound clean.
I was angry because the coronavirus killed so many people. So I wanted it to not kill my friends.
Authorities say myths and misinformation about the pandemic continue to spread, and children are among the most susceptible. Daniel's program, which has reached some 14,000 children so far, is helping to bridge the education gap, not only in schools, but also among vulnerable groups like these children in a village near Abuja.
Some will say only older people are dying because God wants to save the children, and so God is cleaning the earth. We heard all sorts of things. So what we do with our volunteers, because we have to train our volunteers before they go on the field, is to teach them and arm them with information about these myths and say to them, when you get on the field, this is how to debunk it.
Nigerian authorities have been organizing mass sensitization programs to educate the public and try to overcome misinformation they blame for a slow vaccine uptake. But while that happens, Raquel Kasham Daniel will be having an impact on kids.
For the latest news and coverage on the coronavirus, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linahmudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.